The U.S. Census calculates about 49.9 million Americans are uninsured. So the current affordable health care law is rolling out to give all Americans access to affordable health insurance regardless of medical conditions or income. But not so fast. The law is now being challenged in court. Governors in 26 states claim one aspect of the law, the individual mandate, is not constitutional. This measure takes effect in 2014. It requires all U.S. taxpayers to purchase health insurance from a health exchange system. People would buy benefit packages online, in an agent's office, or over the phone. Now the U.S. Supreme Court justices say they'll decide whether or not the individual mandate is constitutional. Next month, they'll hear arguments on this and 3 other provisions. But according to Dr. Eric Ford, the individual mandate is the cornerstone of the healthcare reform law.
That's where a lot of the savings that were projected resided. And if you don't have that in there, then a lot of the expenses that they built in will have to be paid for by the U.S. taxpayer. So it'll mean a net increase in our federal spending, and we either get taxed or get cut somewhere else.
Dr. Ford travels nationally and internationally, advising on how to meet some of the mandates of the new healthcare reform law, especially in the area of creating electronic information exchanges. Health providers will use this system to safely and confidentially share your medical documents. He's also the Forsyth Medical Center Distinguished Professor at the University of North Carolina at Greensboro. Another point of debate is one word in the law's name: affordable. Is it really? Again, Dr. Ford.
The Patient Protection and Affordable Care Act, is it affordable? No, this is not going to be a cheap program by anybody's estimation. You know, the family of 4 today, the median income is about $99,000. The cost of insurance to those people on an annualized basis averages in around $8,000 or $9,000. That means that healthcare is actually consuming more of its earnings than it did a decade ago by quite a large sum, actually.
If you don't have insurance, you're
hurting.
You're pretty much just set out to die.
You don't have a chance when it comes to being sick.
47-year-old Wesley Howell and his mother, 79-year-old Bess Wilson, are sitting in the lobby of the Winston-Salem Community Care Clinic. On this Thursday afternoon, the waiting room is crowded. Wesley suffers from ruptured discs in his back, making it difficult for him to walk. He's on a waiting list for surgery, but doesn't have health insurance. His mother, Bess, says that's a burden on the entire family. In the corner of the clinic's waiting room, a petite woman wearing a black hat is sitting, tediously rubbing her hands together, hoping that the clinic can fill 2 new prescriptions. 64-year-old Vernetta Brown suffers from diabetes and high blood pressure. She thought when she retired in 2009 she would have health insurance, but earlier this year all that changed. Her premium increased to $400 a month, more than she can afford. Vernetta fights back tears.
I've gotten 7 prescriptions. I didn't have the money. You know, I came here, they filled 4, and I had to get the other one filled on my own.
Physicians at the Community Care Center on New Walkertown Road provide free health care and dental services to more than 4,000 uninsured residents in Forsyth, Davie, and Stokes counties. They also see more than 20,000 patient visits each year. And Executive Director Jim Robinson says some of the patients they are seeing are ones they have never seen before.
These are people, some of them who have very good educations. We've had people come through with doctors and masters, just lost their jobs.
No matter what our nation's healthcare reform ends up looking like, Robinson believes free clinics like this one will always be part of the picture.
A Gallup poll released this month shows that at least 45% of Americans get their health insurance through their employers. While most employers would agree that the current system is not perfect, they are united in their discomfort over the uncertainty generated by the change in healthcare provisions.
Will I be required to offer insurance? What kind of plan will I have to offer? Does it make more sense for me to send everybody into the exchange in 2014, or should I continue to offer coverage on my own?
There's so many unknowns right now, and there's so many conversations about repealing this provision or that provision that they're basically doing nothing. They're just trying to make a decision based on what they have to do today.
99 times out of 100, it's in the employer's financial interest to jettison its health plan, pay the penalty, and send its employees to the exchanges.
In the meantime, some in Congress continue to try to chip away at the law, and next March, the United States Supreme Court will review aspects of the Affordable Care Law, including the individual mandate. They'll decide its constitutionality. The bottom line for business owners and their employees is that they will not see any relief from uncertainty for a long time yet.